And this is certainly one of the most common reasons to do a sonogram on a gynecologic patient. And why do we do ultrasounds on patients with IUDs?
Lost IUD string.
That's certainly...
Pain.
Yep, absolutely.
Probably other reasons.
Okay, so again, everybody agrees that ultrasound is the first line of evaluation in patients who have IUDs who have either pelvic pain or abnormal bleeding, or the gynecologist looks and the retrieval string is not visible.
Okay.
But what constitutes malposition? Okay. It isn't just necessarily that the IUD either fell out or migrated into the abdomen somewhere.
Right.
Malpositioned IUDs include expulsion, which is actually fairly uncommon, displacement, embedment, and perforation.
Okay.
Okay. Now, I'd like you to evaluate this patient who had a missing string.
Okay, the IUD, main body of the IUD looks well seated in the endometrial canal. On the transverse image, I would say the same thing, although we can't see the wings.
Okay. Why are you concerned about that?
Well, I'm not necessarily concerned, except to say that they could be malpositioned. We're just not seeing them yet.
All right. So, very good. Now here we do have some cine clips of a different patient now.
Okay.
And you would say, what about this patient?
The one on my left looks pretty good. The one on the right, we're just seeing the body. It looks pretty good.
Okay. So basically, you saw nothing fundamentally wrong with either IUD and the images that I showed you. Admittedly, these are limited images.
Yeah.
Okay. So, in evaluating IUDs, I was a very big fan of cine clips.
Right.
And I think that anybody that looks at these with static images only needs a lesson in ultrasound. Okay. If you're in charge or working in a place that doesn't record cine clips, start yelling on Monday morning that you want cine clips recorded. Okay, I was not a big fan of 3D ultrasound, and I'm still not a very big fan of 3D ultrasound. However, even though I was not asking for these things, our sonographers started using it consistently when they evaluated IUDs.
Right.
Big deal, I thought. Now I definitely want to see the 3D when I'm evaluating IUDs. Let's go back to patient B and look at her IUD.
Okay.
Is there any question that is perfectly positioned within the endometrial cavity? Beautiful.
Looks good.
Looks great. Couldn't ask for more. But now let's look at patient A.
This is the one where we couldn't see the wings.
We couldn't see the wings, and that wing is clearly penetrating into the myometrium.
Embedded. Do you call that embedded or penetrating?
You can call it either. It's embedded.
Embedded, yeah.
Okay. All right. Now, what I'm saying here, and I think you can see from looking at the images, is that 3D can help one more easily recognize a malpositioned IUD.
Yes.
I'll let you look at one more case here.
That is not well positioned.
Okay. Again, that's correct. It is where?
It's, lower down here you can see some myometrial embedment, I would say. Looks like.
Possibly as well, yeah.
Right there. I don't even really see the IUD in this picture.
Well, that's transverse scan. You can see we're up by the corner.
Too high, yeah. So it's too low as well, okay.
All right.
Oh, yeah. Oh, it's really low. Yeah, here.
Okay, now, when you look at the 3D images, you can see without question that, first of all, the sidearms never deployed. And secondly, the thing is literally in the patient's cervix.
Gotcha.
So again, look, I'm not saying that IUD evaluation, ultrasound would not be the first line of imaging in these cases if it didn't do a good job, even back before we had real-time ultrasound.
Right.
Okay, it does a good job. I'm not trying to deny that. What I am saying is that I have been very impressed with cases that I could so much more easily see what was going wrong with the case by doing a 3D image. And I highly recommend that sonographers start practicing doing this. It takes some practice.
Mm-hmm.
And that radiologists and gynecologists ask for these images so that their sonographers will practice and learn to get them. It's certainly not beyond their capability. Every one of our sonographers does it.
Right.